I'm Dutch, and I'm not the first person that from Holland that was visiting Australia. And although it is the farthest to go from the Netherlands, and there were some people before me, and I just learned from Robert Fitzsimmons that Australia was called New Holland. But I think there are a lot of New Hollands around, also in the United States, so they were quite nasty people, these Dutch persons. But going back, not to the past, but now, yesterday evening I thought, okay, when I put in google.com Australia Netherlands, what comes up? And this is what brings us together. This is football. And again, the Dutch were quite nasty. Because when you look back, google.nl, we have totally different pictures. Australia's going down under. Holland's deadliest animals, that are 3 football players. Biggest threats to Australians. So again, the Dutch are not friendly. And this was all about Australia-Netherlands World Cup. And as you know, the Dutch survived this, and they won with 3-2. Okay, that was recent. I'm not going to speak about soccer, but about training in FSH, and not about strength training, but about exercise. Because this is really novel. It is from 2014 and 15, and I have some data about that. And because our main collaborators are the patients, and in 2012 we did an investigation together with the patients. What do they want us to do research on? And they told us, don't focus alone in FSH on muscle weakness, but also look to the patient, not only to his or her muscles, but we are more than our muscles, we are more than our weakness. Okay, and we thought, okay, based on models and based on our experience in other diseases, can training and CPT, aerobic training, in the person with FSH, can that be of any benefit? Because our group in the past published in 2005 that strength training in muscle doesn't work in FSH. And in a recent editorial confirming our data by a Danish group, the editorial said gain without pain. But that's not true, because aerobic exercise training can induce some pain in a minority of patients with FSH. So although this was an excellent editorial, this is something that is not totally true. So there are 2 publications I want to discuss with you. We started this not by doing alone aerobic exercise, but also with CPT. And you would probably ask, why CPT? Because FSH is not a psychological disease, it's a muscle disorder. But with CPT, cognitive behavioral therapy, we want to make the patients more active. So it is not enough to say, go on the bike, because when you do that as a single advice, then people will not adhere, they will stop, because just like all other people, they will not continue doing exercises. Most of these stationary bikes are on the, let's say, are not used anymore. They are in the garage, and so we buy them, but we do not use them. So we want to compare exercise with CPT. Because we do not know, is it enough to do something on the bike, or is it enough to be physically active, to take the stairs and to take a bike? So what we did is we started with 57 patients with FSH, and we randomized them in aerobic exercise, a usual care group, and a CPT group. And afterwards, usual care group was then randomized into aerobic exercise or CPT. One of the questions was, what is aerobic exercise? What we know, it is not harsh treatment. It is usually moderately intense, 50 to 70% of VO2 max. That means you should still be able to talk. 3 times a week, 15 to 30 minutes, and then a total duration of 12 to 16 weeks is what is mostly used in literature. In our study, we looked what the patient exactly performed by heart rate monitors, and we did other studies to exactly know what happened. With CPT, we had the same. We also looked at the muscle. We used ectometer to see what the activity was of the patient, measured for 14 days. And CPT is addressing insufficient coping, some dysfunctional cognitions, for instance, that training is bad, deregulation of sleep, because sleep is a big problem in a lot of patients with FSH, social support, activity, and as you can see, we stimulated the patient to be active in daily life. These are some of the results. The CIS fatigue, which is a score of severely of being fatigued, and above 35 is severe fatigue. And after aerobic exercise, after between T0 to 16 weeks to 28 weeks, you see the fatigue dropped, and it stayed also after the trial, because the trial had a duration of 16 weeks. With CPT, the drop was comparable. So these patients significantly improved in their fatigue. But also in the muscle, we looked at muscle MR, and in the upper muscle of the upper leg, because this was the muscle that we trained also on the bike. And this is the usual amount of fat fraction, not training. And after training, there was a decrease of the fat fraction. Not in all muscles, even there was a difference between the various muscles. This was the best one. You see the difference between the usual care group and the patients that were treated by aerobic exercise or CPT. So this was our publication in 2014. In 2015, just a few weeks ago, our colleague and friend John Wissing had a comparable setup using only aerobic exercise, but he added protein after the exercise in half of the patients, in 41 patients, and he looked more physiologically, we looked more psychologically, and he showed an improved in fitness of 10%, of workload of 18%, of walking speed, and of self-assessed health. The post-exercise protein did not add anything. This was knowledge that came from sportsmen that use a lot of additives and also proteins, but it was not of any benefit in this trial. The dropout rate was quite high, around 40%. So, in summary, our recommendations for FSH patients, based on these two studies, is that aerobic exercise is safe and feasible. The study by Wissing checked the CK levels, the levels of the of breakdown of the muscle, and can reduce fatigue in patients that are severely fatigued, which is 3/4 of the patients with FSH. Can improve fitness and slight muscle pain only in a minority and only for short duration. CPT is probably even more effective, at least more efficient, because the patient in our study that get aerobic exercise had in total 42 sessions, whereas 5 sessions of CPT did the job in the same way. And there were no side effects, also no muscle pain. So in the past, we learned, when I was a medical student, I was taught that traditionally patients with muscle disorders were advised to reduce the physical activity in order to preserve their limited motor function for activities of daily life. So remain your energy for the everyday life, because don't lose it. Other people said, you are not going to race with a broken motor, so don't train. But they meant strength training, and strength training of a diseased muscle is probably not a good idea. But we are training not for the muscle, but we are doing aerobic exercises, which is training the whole body, including the muscle. And we showed by muscle MR that the muscle at least is not detrimental and possibly even better. So what we learned is we lost a false concept that training was a problem in FSH, because what we can say is that for all of us, with or without FSH, training, moving, exercise, aerobic exercise is beneficial. But usually we think it is good for others. And so we look at ourselves probably a little bit better as what I depict here. And moving is good for our dogs, but also for us. And I'm always impressed by the fact that the muscle is the molecular motor and that there is movement in our body on different levels, and that you can see it in what's called the in vitro motility assay, where you put on a plate the myosin and you put on actin and ATP, then these proteins move. So not only we, but our proteins are also made to move. And when we are able to decrease our inactivity, we can postpone our chronic diseases for 10 to 20 years. And we are increasingly understanding the biology behind it. Probably obesity and inactivity is causing chronic inflammation on different levels. And by exercise, we can decrease this chronic inflammation. So, but time is a constraint in our society. What fits your busy schedule better, exercising 1 hour a day or being there 24 hours a day? So it is for all of us, not only patients with FSH. The training is really a time problem. On the other side, exercise can be as beneficial as the drugs that are prescribed in diabetes type 2. So that is a big thing. And exercise is such a convincing intervention that industry is trying to find an exercise pill to at least give us the impression that we look thin, that we are better. So that is some of the things I want to investigate the coming years. What is the molecular biology of the muscle that improves after exercise? Can we find substances that can mimic exercise? Can we find pathways that are positively affected by training? So aerobic exercise in a person with FSH can decrease the burden, not the pain, but at least the fatigue, the sleep disturbances, and the physical inactivity. So I already showed this summary, and I showed it also yesterday. I think there's a place for aerobic exercise in some of the patients with FSH. And it is also feasible because a stationary bike is available and other types of exercise are also possible. So it is some of the patients with FSH, they tell me that a rowing machine is for them the best way to do exercise. Other swimming, and other side, CPT is not widely available. We are now doing a trial in Europe in 4 different countries, and we managed to find in Paris, in München, in Newcastle, and in Holland people that could help with CPT and other disease. But at the same time, being active in daily life seems to be equally okay compared to sitting on a bike. It is also doable because the frequency and duration is 3 times a week, 15 to 30 minutes. And CPT support can improve the adherence and probably also make it more efficient. It can also last because after 1 year, 61% of the patients in the visiting study, the Denmark study, maintained the training, whereas after 12 weeks of our study, 17 to 67% continued the adjusted level of activity. So I started with sport, I will end with sport. For Australians, soccer is not the sport they like. They like rugby, so it is not such a problem that you lose against the Dutch, because we are very bad in rugby, I think, although we are more built for rugby probably. So I want to end by thanking the FSH Global Research Foundation for inviting me. Thank you.